So welcome to our June Path Collaborative Planning and Implementation Northwest Collaborative meeting. I am going to pass it over to Rachel McCullough-Sandin, who is our wonderful program manager for this body of work, and she's going to take it away.
Thank you, Catherine. Catherine Stewart is our Director of Learning and Action team at Phil. And I'm really pleased that I'm accompanied here with a handful of wonderful, amazing colleagues that contribute to our work. Especially grateful for all of you participating in our Northwest Collaborative as we join together to address implementation challenges for enhanced care management and community support services with our CalAIM initiative. Next slide. Our land acknowledgement is very important, and the Population Health Innovation Lab respectfully acknowledges that we live and operate on the unceded land of Indigenous peoples throughout the U.S. In the chat, you have the opportunity to click and explore the traditional territories of tribes where you are with the native land map. All right, next slide. Our agenda and objectives for today. So we'll bring everybody in. We've got some wonderful updates from partnership and continue to be very grateful for their collaboration and support. We are going to be going over our feedback loops within this group and how we are responding to the systemic and technical issues that we share here and learn about. DHCS has some updates that we will be sharing, and then we're going to do a quick introduction to process mapping to gauge interest, and a quick update on our asset mapping demo that we recently hosted with some next steps and upcoming events. So we want to make sure that we're understanding the issues that partnership and DHCS are actively addressing, exploring our feedback system, and we want to go over the services that we can offer you. So Phil has a number of ways that we can support each of you and your organizations going through implementing ECM and community supports, and of course, figure out what we have interest in to do together next time. Next slide. So a quick overview, not as many background slides as we've done in the past because we know most of you guys are old timers at this point. If you are new, we're so glad you're here. Please, please, please connect with us, email us, look at our website. We really want to learn more about your organization and how we can help you. So we are here in the Northwest region with Delaware and Humboldt counties. Next slide. And then our CPI initiative under the CalAIM Path initiative is we are the CPI group that will identify our needs and gaps to deliver the ECM and community support services, resolving those topical implementation issues, supporting gap filling plans while avoiding duplication with other forums. Very important. If you have other meetings that would be helpful for us to attend to make sure that we're doing complementary efforts, we would love to be there. Or if you want to share other initiatives that are happening, and we also look for those as well as we are going about our daily work with you all. So we will be able to identify potential resolution strategies to overcome challenges together. Next slide. So we have an incredible partnership with partnership in this collaborative, and we continue to be grateful for their engagement and transparency. Next slide. So I want to introduce, we have Chloe and Bianca with us here today. They're going to be going over some wonderful and helpful updates, including responses from our Maze convening that we have posted on our website, and other helpful information. Chloe, Bianca, over to you.
Thank you, Rachel. Good, it's still morning. Good morning, everyone. We just wanted to touch on the issues that were raised in the Maze convening. The issue of the enrollment tracking, just for a quick recap, providers find the enrollment information in collective medical, which is updated monthly. We are actually working on enhancing the collective medical portal to allow for all ECM members to be displayed for all ECM providers. Keep in mind there is an auditing tool in place that if you guys are going in there and looking up members that you should not be, we will be able to keep track of that. But it is to allow for our providers to know whether the member is already engaged with another provider, to help alleviate any kind of duplication of efforts and trying to outreach and engage the member. So we want that transparency and that visibility for all of our ECM providers. That way you guys are able to focus on the members who you can engage, and you get credit for enrolling them versus somebody else and you doing it at the same time, and then they submit the TAR first. In the meantime, we are sending you your monthly information files. As I'm bringing up this topic, I did want to touch, we announced it in our roundtables last week. DHCS did make some adjustments to the required reporting. So we have updated our templates. We've sent them out to our providers for review and comments. If you guys have not received it, please let us know so that we can get you a copy. And since we brought up the roundtables, we have those monthly, and we can provide the link to those as well. So then the next topic that was discussed was the care plan development. Providers are spending considerable amounts of time with the members conducting these assessments, and in order to have that care plan with the TAR for it to be approved, the current policy, that is our current policy, and there are suggestions from the breakout groups in the meeting discussed with DHCS on June 9th, but no decisions have been made at this time. We will keep you apprised as we have more information, and if you have any questions around that or comments or suggestions, please feel free to reach out to partnership. We appreciate the feedback. We thoroughly enjoy that open communication, so that way we are doing the best process that works for everyone. And then there were some TAR and billing challenges that were brought up. There was difficulty submitting TARs and the correct billing information, finding the coding requirements, and especially for those who are newer to being a Medi-Cal billing provider. We have a number of providers who have offered to send out their cheat sheets and shared with the group. We would also like to offer our claims team. One of our key individuals, Bonnie, she's amazing. If you need an extra one-on-one session, by all means, I can put the general inbox in the chat as well. And you'll be able to connect with her and get one of those set up. If you need a refresher because you've hired new staff, please use that avenue as well. We have no problem with doing as many trainings as we need until you as the provider feel comfortable. And that way it eliminates room for errors down the road, and also frustration with the back and forth of trying to work things out via email. So if you want to schedule that, I will provide the information in the chat. And then there was an issue raised about the potential member lists from DHCS risk stratification. I can't talk today. I'm sorry, everyone. Providers expressed their concerns about the quality of data that was used to generate the potential member outreach lists. The information in the data was outdated, or the member may be in prison or expired or deceased at that point. The providers requested that the list be vetted more thoroughly. We have taken this feedback in, and then also during the DHCS meeting on June 9th, we were looking for any best practices that any of the other health plans were using. So we are working on this. We're wanting to ensure that the data that we're pulling is as accurate, but that means that the member has to be updating that as well. So we are limited on what we can do as far as the data mining referrals, but for the members who are self-advocating, or the members who are referred by providers that they are actually engaged and concerned about meeting their healthcare needs, those ones are a lot easier to connect with and get updated information. So we hear you, we understand the frustration, and we are looking at ways to find the most up-to-date data so that we can provide it to you as the provider. Let's see here. And then did you want me to go ahead and share screen as far as the PHC website or to display the separate ECM pages, or did you want me to just, oh, it looks like you already put them in the chat.
Yeah,
Yeah,
I
we've got the
could
link.
co-host just in case you did want to share.
Okay.
Yeah, feel free either way.
Yeah, let me go ahead and get a window opened up over here. Can everyone see my screen okay?
Yes.
Perfect. Okay. So we have, if you are not aware, we originally started with a single CalAIM webpage that contained information for community supports and ECM. But as this is almost a year and a half into the benefit, it's gotten completely overloaded with information, resources. So we broke them out into their own individual web pages as well. So there's a number of different ways that you can actually find it. Under the providers tab. Yeah, under the providers tab, under health services, there's the CalAIM, enhanced care management and community supports. Under the community tab as well, there is the CalAIM enhanced care management and community supports web pages. In these web pages here, you'll have a number of different items, the reporting templates, the reporting recordings, and just a disclaimer, we will be updating these based on the templates that we move forward with, that you guys as a provider provide feedback on. We have our policies, helpful resources and forms. We have any DHCS materials here. And then in this section here is where you will be able to go ahead and register for the link to our roundtables. And the one above it has a link to a number of different recordings. And the recorded link here doesn't have a line under it, but it is a hyperlink. So if you are interested in taking any of these trainings, that is always available to you. You don't have to be contracted yet to explore anything on this site. The same goes for the community supports page as well. Bianca, did you want to add anything specific about your page before we move forward?
Yeah, sure. Thanks, Chloe. So I just wanted to make note, same thing for ECM. We try to update this page on a regular basis. And I just wanted to call out under the DHCS resources, we've actually added the DHCS CalAIM guidance for the community supports member information sharing, which will begin in September. I just wanted to let everyone on the call know for our CS providers, we are working through that process internally. And at the next roundtable in July, we will be sharing more updates on that with our CS providers. And that's it. Thanks, Chloe.
Of course. Okay. Oh, I lost it. Darn it. 1 second. Okay, so then the next thing that we wanted to kind of walk through, we have a draft kind of started, but it has not been reviewed by our communications team yet in order to distribute it. It's just a quick how-to on where to go into the provider directory to search for ECM or community supports providers. So if you select the providers tab and go over to the provider directory, you can select facilities. Any of those options on that front page will get you to this page. It's just a more modified version of these over here. So your basic search, always click the specialist site right here. Under the facility, type of facility, you have your enhanced care management option. And
Chloe,
you also,
we're not able to see your most recent screen.
oh, okay. Let's see here. Can we see it now?
Yes.
Yes.
Perfect. Okay, so once you click on the doctor facility options, it opens a new window. And on the side over here, you could do the specialist site search for basic search. Under your type of facility, you have community supports, and then you also have enhanced care management. If you were looking for a specific zip code or county, you can narrow the search down even more. And then once you hit the search button, it will take you to another page here. And then it lists off those who are contracted for ECM. For the community supports portion, let me jump back here.
Chloe, we had a request in the chat if you could filter for Humboldt County.
Absolutely. Under ECM or community supports.
No specification in the chat. Do we have a preference from participants?
I'm gonna guess
it's
ECM, okay. For ECM, our contracted providers, please note that they are contracted and in the directory, but it may not mean that they are actually ready to go live and exchange files. That could be contingent upon their available capacity at the time. So all of these are contracted providers. It's just a matter of if they are actually servicing members. So we have Redwood Community Health Center, Arcata House Partnership, Perinatal Services of North County Clinic, Redwood Community Services, Fortuna Community Health Center, Ferndale Community Health Center, Eureka Community Health Center, Home Health Care Management, Humboldt Senior Resource Center, Redwood Women's Center, and then additional pages. I'm not going to read them all to you, but if you are curious, that is the way to go about filtering. And if you want to adjust instead of going back a page, you can always reapply filters in this section. So if you wanted to switch, you no longer wanted to find your ECM providers, you wanted to see who's an ECM, or excuse me, a community support provider in Humboldt, you'll just change the drop down and it will give you a list of those providers here.
And if you wanted to see if somebody was actively providing services, what method would you recommend to do that?
So for the providers that are actively providing services, the best way actually to do that is through collective medical. You'll be able to see with the member who the groups list. It'll have the list of providers who are actually exchanging files. Because in order for your collective medical portal to be complete, we have to have uploaded a file. So at that point, everybody that's in collective medical that has members assigned to them is a provider who's actively exchanging and servicing ECM for the members.
Thank you. We have a few minutes for questions. Was there anything else before questions from you, Chloe or Bianca? All right, any questions? In the chat, unmute your mic, raise your hand, whatever brings you the most comfort. And we really appreciate all of the updates. I think it's especially wonderful to have so many issues and raised in our last convening and then to be able to get that response on paper. The link for that document of those issue responses that Chloe was reviewing is in the chat. It's the bit.ly link for May's convening. It's above the partnership link resources. So you can also use that link to share with colleagues. All right, anything else? And again, once those directions are finalized, we will also help disseminate, and I know they'll be on Partnership's website too. Great. Chloe and Bianca, thank you so much. It's a true privilege to have you here.
Thank you for having us. I have to jump off for my next call.
Thank you, everyone.
All right. So in the same vein, we wanted to continue talking about the feedback loops and responding to our systemic and technical issues that come up in these meetings together. Next slide. So we know that a few months ago, we put together this mutual challenges slide that we've shown before, and just sharing that we've got technical, relationship, billing issues and system opportunities in each of those buckets. And a lot of us are experiencing similar challenges, though we do know there are unique scenarios, either to types of organizations or specific organizations. So we are using this information that we gleaned from you for both activities and developing these feedback systems. Next slide. So this is one of our Jamboard slides from last month, both in the Northwest and Southwest, the regions that we help facilitate. We did these activities, and together we came up with systemic challenges and solutions of delivering services. And so these Jamboard issues and that activity is the main source that Partnership used to be able to provide that document and those specific updates for us. So it's just one example of how we are moving strategically through the information that we're sharing together. Next slide. So we have these feedback loops as communicated by Partnership with their participation and our conversations together, continuing to go back and forth. Next slide. Resulting in resources and updates that we share on our website and also here in our meetings together. And so again, the resource page is in the chat, and that is where you can find the document that Chloe was also sharing the updates on. Next slide. So we know after a lot of our time together that we have system levels at which challenges occur. So these might be technical platforms working with collective medical or Partnership, which they continue to be receptive to. Organizational, we know that we have heard that we are each experiencing challenges around staffing, or some of our smaller CBOs have had concern about financial sustainability, FQHCs with specific billing. So lots of issues that may be particular to that organizational level. And then we have county systems that have already been in place. And so we know that it's important to address specific counties. We know that we've got counties grouped together for our regions, but there are still county systems. Then there are regional, because we know that people move. Certain organizations are larger than others and interacting with organizations across the region. And then, of course, we know that we have policy level issues in which advocacy or awareness at the DHCS level is necessary. And so one of those issues that have come up are requiring care plans in advance of enrollment, for example. And so we are sensitive that these levels are extremely important to analyze and route accordingly. And then, of course, we have these categories of implementation challenges: billing, referrals, care coordination, and others. We know that sometimes interim workarounds exist. And then, of course, the sources for longer term solutions are different depending on those levels, whether those challenges are shared across many partners or whether they are unique to a certain type of organization, or again, an organization in particular. And so we wrapped our heads around ways to develop a system to track and organize all of this. It's a lot, and we want to make sure that we are doing our jobs as facilitators so that as we share information, workarounds, and solutions, they are tracked and funneled into a productive and efficient place. Next slide. So this is a visual that represents some of this work. And so information can be gleaned at our monthly collaborative meetings. We've had one-on-one and group calls with some of you. We would love to continue learning from each of you about where you are and what you need. So whether we haven't done that with you yet, or whether we have and it's time to do another one, we would love to connect with you for more. Of course, our email inbox is always open, and we've gotten some good feedback that way. We also, it's very helpful when we attend the ECM roundtables for partnership, that is also a great forum, not just for our counties, but for counties across Northern California that partnership is providing services for. And so we've developed a tracker on the back end for a lot of those issues. And we include the current workarounds that are shared. And then this tracking system is communicated with partnership. And so that is a system that is being implemented and refined. And of course, PCG, which is the CPI administrator with the state, and we report to them. They both have bidirectional communication with DHCS. And so a lot of these issues end up on the DHCS radar because of these various systems that are in place. And then on our radar, there's a lot that we can help you with directly or help facilitate, which is one of our main roles. And so together we're working towards those future solutions and tracking that progress and reporting back out on that in these meetings and in the resources that we're providing, both the workarounds and the solutions. Next slide. And so this is another slide that we've displayed before. A lot of the strategies and ideas that we have collaboratively developed here can fit under services of those umbrellas of capacity building, collaborative systems improvement, relationship and network building. And so this is what some of Phil's expertise, and we want to continue offering. Next slide. So we don't know what we don't know, and we wanted to be more concrete and specific about saying we are here to help you address those implementation challenges. And so what are the actual things that we can help you with? And we touched on some of them in our convenings, but we can do this in these larger convenings, in smaller groups if there's organizations that are having similar challenges, or one-on-one with you. And so it might be bringing in guest speakers or subject matter experts. Maybe you have someone in mind. Maybe you said, we want to hear from somebody who knows more about XYZ. Again, the technical assistance, whether we provide directly or connect you with the TA marketplace, or maybe a bridge while you're waiting on the marketplace, because the marketplace is an invaluable resource with both off-the-shelf packages and also tailored one-on-one consulting with approved vendors. If you have meetings in your organization and you want help facilitating meetings and projects, I mean, not project management, but the meetings, that is something that we also have skills and expertise to do and to facilitate related topics. Quality improvement support. Maybe you want support around developing a PDSA cycle. Maybe you want to work on process mapping, which we'll touch on in a little bit. We will also continue to disseminate resources from partnership and DHCS. We have also reviewed a grant application. We know especially some of the smaller organizations don't necessarily have a grant writer or staff person experience in that. And so all kinds of different concrete specific examples of how we can be here for you and want to learn about what you need and provide those services. Next slide. Oh, good. I was hoping the slide was next. So questions, if you want to go back to the diagram or services, maybe we can go back one and just kind of rest on that services slide. But if you have any questions in the chat, unmute yourself, raise your hand, again, whatever makes you the most comfortable. And how can we best serve you? What clarifications do you need or want? For any of that. And I know there's been a lot of updates. We wanted to accommodate partnership schedule. Throwing these at you. All right.
Um,
We will
I
please.
just I just wanted to clarify, are all of those services that PHIL can provide free of charge to us, or does it depend on how much time and what exactly it is, and then we might have to pay for those? Could you clarify?
Completely free. If it ends up being huge and long and extended, you know, we might try to figure out a way if there's other resources out there that Partnership or the Marketplace or others are offering. But we've had multiple, you know, one-on-one sessions with various organizations. And so, no, we're free. We're here for you. We want to help. Let us know what you need.
Yeah, thank you for asking that, Tammy. I appreciate that question. And, you know, just to reiterate what Rachel said, really the whole purpose of this body of work that we're, you know, trying to facilitate is to be here in service to you, our collaborative members, and really to do whatever we can to help support you in the implementation of, you know, enhanced care management and community supports. And that doesn't mean that we know everything about everything. There's a lot we don't know about, but we have a lot of connections and a lot of, you know, a lot of ways that we can help figure out how to meet those needs that you have. So please, that this is the whole purpose of us being here for you. So we would welcome the opportunity to work with you and help figure out how we can help, you know, support any issues that you are, you know, encountering, because there's also the likelihood that you're not the only one. And so what we learn in supporting you all can be, you know, spread across not just our collaboratives, but, you know, the other collaboratives that are working across the state.
Awesome, thanks.
And if you want to drop your email in the chat, we can definitely refer to that and reach out to you. And you can always email us at our PATH email address as well, which we'll be posting a couple times. Great question, and thank you, because I should have led with that. Free service. What other questions or clarifications do folks have? And totally fine if your brain thinks of stuff later. Always put things in the chat, unmute yourself, raise your hand, whatever is most helpful. All right. So now we wanted to give some DHCS updates. We had a large California-wide CPI facilitator meeting. So everybody like us got together, and we had some updates from our administrator of PCG with the state, but then also DHCS was there, and they gave us some basic updates about how they have heard you, and they are addressing challenges. And so if we go to the next slide, we are going to give you a brief overview of the topics that DHCS shared they are addressing with us, and some information from some other meetings. I want to address Stephanie Hertzfield, who is our wonderful consultant and one of our TA providers, speaking of services, but she has a lot of experience in this realm and is always in the know with updates from DHCS. So I'm going to give the next few slides to Stephanie, and we'll switch up voices here. Stephanie?
Okay. Thanks, Rachel. And it's great to see some familiar faces, like Zoom faces on here, and thanks for coming back. And I think it's great how Rachel framed kind of the purpose of what we're here to do for all of you as CPI facilitators, collaborative planning and implementation, because it is collaborative, and we are charged with figuring out what's not working. What are your issues? And I think that's never the framework that I like to take with things. It's always like, what's working? What can we replicate? Or, you know, if something's not working, let's look at ideas. And ultimately that is what we're doing. But first we have to kind of uncover what's happening. So this whole call is about, we're really focusing on how do we improve, what are the feedback loops, what have they heard, what are we hearing, what are different partners hearing, and especially this kind of pathway of networks, I would say, of how information flows in the entire CalAIM process, which is gigantic, and we're all one cog in the wheel, important, but one cog. So I just wanted to point out that when Chloe was giving her update from the partnership perspective, she kept referring to a June 9th meeting, which I think none of us know what the June 9th meeting was, but it was actually pretty fantastic. I wasn't there. It was a meeting of all of the managed care plans in California with the Department of Healthcare Services. And I also want to say, if any of you hear an acronym that you don't know, we're trying to be conscientious, but just shout out or chat it out, call us on that, because we want to be very inclusive. So that is the first step to this DHCS update, is that DHCS, they've done it before, but they said, we are hearing feedback. We want to know what's working, what's not working specifically, and we want to streamline things to make it better for everyone who's working on the ground, who really is working with Medi-Cal members. So that was great. So they all met on June 9th. And then on June 12th, they brought together, we're called a CPI facilitator. So there's 25 groups like this around the state, and we're all doing the same thing in a little bit different ways, or same things are coming up. And a lot of you have asked, is what we're saying making it up to DHCS? Do they hear us? Because a lot of this needs to be fixed. Things aren't working great. And what I want to say to you is, yes, all of us, the 25 facilitators, were 25 groups of facilitators. There's probably like 100 people on that call, were kind of jaw dropped and thrilled to hear, like, okay, there's going to be changes. Can we tell our groups? And I'm here to say, like, I can kind of sort of tell you, Rachel and I, we're going to give you some high level overviews, but we can't share the slides, and things may change because they're negotiating a few details. And what we're hoping to do is invite a panel of some DHCS representatives here for August after everything's final, so that you all can hear from them directly and ask your questions. But it should be great. So now we'll be a little bit more quick. So here's what they heard. They heard that they need to streamline things up at the state level, push down to all of the people doing the work on the ground. And also they really need to listen consistently to trends coming across the ground. So that was their main message. And the theme was really about if they want enhanced care management and community supports to really work, then they need to streamline things. So the areas that they hit upon on where they're going to streamline and make it easier for all of you was are standardizing eligibility. And the issue that they heard is that there's too much and a lot of variation in how the managed care plans are applying kind of the population of focus criteria. So they're going to try and it's causing confusion and it's limiting uptake. So they're going to try and standardize that across MCPs. We're all pretty lucky in these regions because we only have one managed care plan, but that might change. Anyways, so that's one of the things they're doing to address this, standardizing eligibility, and they have the power to do that. The next thing is eligibility criteria, that some of the managed care plans are kind of narrowing the eligibility criteria for community supports relative to the actual service definition for in lieu of services. And they're going to put a stop to that. So it's like, no, you need to stick with the actual definition. So that's going to be nice. Also, we've talked about TARS a lot. We know that that has been difficult, and they really want to streamline the authorization and reauthorization decisions. They just want parity across all Medi-Cal members. So that is in process, which I think is really good. The presumptive authorization, that works for like street medicine and some other things. That helps streamline access. They know that some managed care plans are a little bit resistant to presumptive authorization. So they're working with the managed care plans on that. Let me think, that might be too much detail. So they want to help with expanding the provider networks and streamlining payment. Yay. So managed care plans are obviously used to working with primary care, FQHCs, and kind of a one size fits all model for payment. And now that they do want to be inclusive to social service organizations, community organizations, expanding counties, opportunities, but they really are missing the opportunities for partnering just because it's a very different model. And the folks who really know Medi-Cal members the best. So they're coming up with policies that require better partnerships with community and social service organizations, because they're understanding that just managed care plans didn't know how to do it. So they're going to help them and require some things. So that should be, I think, very interesting. My background's in a lot of working with community organizations and aligning with that, with payers. So it's gonna be fun. They want to strengthen just market awareness. How do we get the word out to people in the community? How do we access them? And, they are hearing that we're all overwhelmed with information. Of course, they send out, like, I always say, like 20 to 30 updates a day. Like, I'm overwhelmed and I'm not seeing patients, but, and then the last one really around data is just that some managed care plans were requiring providers to use their specific portals, and they're not going to be able, unless something changes. I have to default to that. Unless something changes, they're not going to be able to require that anymore. They can provide a portal, but they're going to try and make it a little bit easier and more flexible for folks. So let's see what happens. Should be finalized in July. And if it sounds good to you all, we're definitely going to try and have some DHCS folks here, because all the facilitators said, can you come present to our region? So tell your friends, this should be good, and partnership will definitely give an update. So I think that's all I have for DHCS, but it was really good to know that they heard us. Yeah. Oh, I forgot. Yes. And just hopefully all of you are aware that the enhanced care management for children and youth, or the pediatric population of focus, is starting July 1st, or it's available. It doesn't mean any of you have to start serving that population July 1st, but it becomes available. And on the screen are the list of the populations of focus. I think 2 are starting a little bit later, and I don't have it in front of me which 2 are starting later. And we're going to talk about how to make decisions around a lot of things. But if you're contemplating, should I add this as a population of focus? Should I add the children, youth, or just one of these, or anything? We're happy to help you with some of those decisions, and so is partnership. So just know this is all available to you starting July 1st. There's a lot of information about it out there, but there's a lot out there. And there was a really good webinar about it last Friday that DHCS put on. The recording and slides are not yet available. They seem to take a couple months to get their slides up. So we're working to try and get all of you the slides a little bit earlier, just because it was so helpful. And we will for sure send that out to you. And I'll pause there. Does anyone have questions about any of that information that I went through? It was a lot. So.
We also have some links in the chat where you can go to the page with those webinars, and also subscribing to their stakeholder email services. There was one other slide with the announcement for potential funding that we can show. And Stephanie, I don't know if you had a sentence or two to speak to that. And we'll be distributing these slides. And so it's a lot of information, but we can go to the next slide and then we'll send these out to everybody.
Yeah, there are often grants coming up. I moved that one. It's about a tribal health initiatives grant. And what I want to say is, in the services that we can offer to all of you, we can help with grant applications. We've done some reviewing for a couple folks, and we're happy to do that. And then, so also, if you want help knowing which grants are open or not, and when they come open, we're happy to help you kind of sort that information, because it's just so much to follow. So right now there is at least one that's specifically open to tribal entities, and that it's at the end in the appendix, all the detail of it. But there's also probably about 3 more. There's behavioral health grants, there's data grants. Everyone knows about cited grants. The window just closed on those. there will be a round 3. So we don't even have to help you write it. We can just help you figure out what's out there. So anyways, yeah, please ask questions or reach out to us if you need more time to think about it.
And Tammy, this particular slide is so helpful. Where can we access right now? And do you mean the slide with the youth population of focus?
Yes.
Well, oh, I have a link I'll put in to where the model of care for youth population of focus is. This slide will send to you. I just made that based on the model of care, but I'll put that in the chat in a minute, what the youth model of care is. And then Partnership also has their model of care, but I haven't seen, I don't think Partnership is still on. I was curious to see what their dates were for youth population of focus. They might have specific dates on it, and we'll find out, and we'll follow up with that. But you'll have this slide. We'll send them out after the call. And then I'll also put the model of care link for DHCS in.
Thank you. And the funding that's available right now for tribal entities, it's on the DHCS website. If someone could provide that specific info, I'm having trouble finding it as well.
Oh, sure. I'll put that in right now because I moved that, and you should put it in right now. Okay, here it is.
Thank you.
Yeah, no problem.
What other questions do you folks have?
Are the dates out yet for when that round 3 of cited funding will be opened?
I have not seen them. I don't think they're out. Round 2, those folks should find out September to October. It's supposed to be September, but the funding starts in October. So I think early fall they might announce the dates, but it is up on the website. If you look at the cited page, which I bet Jessica can get to that faster than me, it says round 3 is definitely coming. So I think that's all we know right now.
Okay, thank you.
Mm-hmm.
And if you have other suggestions of things that you would like us to look for, or if there's helpful communications, questions or suggestions, open to all. Thank you. Jessica just put the cited web link in the chat. And Stephanie found the ECM model of care.
And we're always here for you. You know how to get a hold of us.
All right. So let's take a couple minutes and do an interactive check-in for introverts, because it's a poll. But if you have questions or want to chat about any of it, please, as always, unmute. So you've seen this before if you've been with us. I know most of you have. So we are tracking progress for each of us on this readiness roadmap poll. And so we have these different steps along our readiness roadmap towards ECM and community supports implementation, starting from what are ECM and community support services, all the way through exploring contracting, applying, getting a contract, testing service delivery systems, and then implementing, making it work, but still having challenges, to the last step of just being super coordinated, everything seamless and wonderful, and all is well. And so one of the best ways that we can help is being able to understand where you are. And that way we can both track progress over this year of how we progress together. But also if somebody's going really quickly, maybe learning about their secret sauce, or if somebody's hanging out at a step for a while, just kind of checking in and seeing how we can help. So we will launch a poll, and I think it's just a few quick questions that everybody can respond to. And we're just checking in the And feel free, you can answer them all at your own pace. And essentially, you know, when did you start coming to our CPI collaborative meeting? Where were you then? And our third question is, where are you now? So 3 quick questions. And if you would like to be featured at any of our monthly meetings, we are looking for organizations that have success stories, big or small. It could be anything from, you know, we really had to work together internally as an organization to decide whether we were going to apply for a contract, or it could be, you know, all of that contracting process went smoothly. We know we wanted to do it. And once, you know, we were trying to provide services, we hit this one major roadblock, and this is how we worked our way around it. Or slow and steady won the race, and here we are however many months later, and now we're finally providing services, and this is what helped the most. So if you want to share your story with other organizations anytime in the next few months, we would love to hear from you and highlight you. We'll just give it another minute or two. I think most people have responded. And it's really wonderful. It looks like we've got about half of us that started way early and half of us that have been here once or twice. So that's wonderful. We really want to keep recruiting. If there are organizations that you think would benefit from being here, please do reach out and share the resources, put them on our radar. We will reach out to them as well and offer services. And it looks like a few of us have definitely made progress in the last few months. And so that's really exciting to see. All right, we can close the poll. Wonderful. And if you're curious, I think you can maybe scroll through those results potentially, but the overview, why is it? Okay. So now we are going to do a quick intro to process mapping. And this is both for the sake of giving examples of other parts of our feedback loop and addressing systemic challenges. One thing that we heard from a lot of you is the systems and organizational structure and understanding of the environmental landscape for providing services was murky for some organizations. And so being able to build process maps, which Stephanie is going to define and go into for us, is important to be able to explore. And mostly we want to circle back to this idea of exploring process mapping together, checking in with where you're at now and your interest for being able to engage in these activities in the near future in various formats, one-on-one or group activities. So I'm going to hand it over to Stephanie, who will go over, and we'll have another interactive opportunity to express interest after her time.
Forgot what I was doing. I was like, should I unmute? Okay, so I just wanted to, this is definitely gonna be a very quick introduction. Some of you may have been doing process mapping, or some people call it workflow mapping or flow charts. We can call it a lot of things. Again, if I use jargon or terms you don't know, just, you know, raise your hand or jump in, definitely jump in. And the reason we want to take a look at this is we did discovery calls starting in February. And then, as I said earlier, we've been gathering your feedback for months and really listening to you about what's working, what's not working, what's hard. And what came up a lot is, what is the process? There's not a streamlined process. These are quotes from all of you, not all of you, but a sampling of quotes from many of you. And figuring out, and I kept thinking, well, there's got to be some process maps, or there's got to be something written down that really succinctly shows some of these processes, because I do feel like CalAIM is really well strategically thought out. It's organized, and there's just got to be something that's visual and quick. I haven't found it yet, at least not. And some of you have shared your cheat sheets, which are excellent. But I really can't find those. And I feel like we need them because you're all busy people and this is hard stuff. So we want to just, do a quick couple minute introduction to what is a process map, which some of you may know and some of you may not. Either answer is fine. And then just see if this is something that would be helpful to you. So these are some of the things you said. And then going on to the next slide, we'll look at what actually is a process map. I can't advance the slides. There you go. Thank you, Vanna. So what is a process map? You'll hear this term used a lot. And again, you might interchangeably hear a workflow map or a flow chart or anything you want. But for the sake of consistency, we'll call it process mapping. And so a process map it's a visual representation or a picture of the steps in a sequential order of really anything, but a process, something to get accomplished. It can be a decision, how are you going to make a decision, but it's something that has to happen sequentially, really, in order to get from point A to point B, whether it's in your mind or with a group. And what I always say, and you can see some of these elements listed here too, and some people are really visual thinkers and they love these maps. And my team here, my Phil team here, has joked because one time I said, oh, I'm not a visual person. They were like, really? And I actually am. I need everything visual, but these kinds of maps are really hard for me. So if I see all these shapes together and they're all filled out, after it's done, I can't follow it. But what the best part of a process map is for me is folks working together to say, where do we start? And then if this, then what happens? And you should disagree a little bit or talk about it and then think about what comes next. And it's that process that really gets you all on the same page and has you think about what's going on. So that's what a process mapping really is that process. So here's an example of a process map. And I'm not sure if you can read it or not, but oh, thanks. So this is one example of something that like we could do with you or you might want to do. And this example, and you'll get these slides, is saying, so what if I'm a street outreach provider and or our organization is, and we want to decide if we think becoming contracted with partnership for ECM services or, ECM is a good idea for us or not. Does it make sense? So you might, start here with, we contact PHC. That's the first thing you do. Let's get some information. But then these, oh, I forgot to put the key on what these are, but then the green boxes are really internal decision, not decision points, but thinking about things. So we need to think about what populations would we serve? What would be the populations of focus? How's it going to impact us operationally, financially? And then the orange are really like predetermined processes, like what things can't we change? We'd have to really look at the things that are in the written process. And then we need to, in the Medi-Cal MCP process. And then you come down and discuss again as a group and do a cost benefit. Does this make sense? Not, and then you get to key decision points and say, is this the right time? Are we ready to do it? Financially, operationally, does this make sense for us administratively? And if yes, then okay, let's start working with PHC. Let's sign it. It's going to take 3 months before everything's really up and going because there's a lot of administrative work. Or maybe you decide because you've really taken the time to look at all the pieces, you know what, we're not quite ready yet. Let's give it another 6 months or so. But we can do community supports. That seems like a lighter lift. And we're already doing housing navigation, and we'll pick 3 of that community support. So that's an example because everything does seem overwhelming. So that's just one concept very quickly of a process map and what you might go through as an organization for that particular process. And if that feels like a lot to you, another example, you can go to the next slide, of a process map. And if we were in person, I would do this with you, is like looking at how do you make a peanut butter and jelly sandwich? You don't have to show all the steps. I don't know who's zooming in and zooming out, but yeah. And you might just say, where do you start? Is a decision point, wheat bread or white bread, or 2 pieces of bread, or where do you put it? And it's still going through the decision points, the decision, what has to be made. How do you describe something? This is a great process to do with folks. And like when I'm looking at this picture, I would not recommend putting jelly on top of peanut butter. That seems weird, but maybe someone else would, because then the jelly doesn't soak through the bread. But in the end, someone has to be able to follow the instructions, go through the process, and come out with a successful product or decision at the end. And this is really fun to do when you're in person, because you come up with a process and then you have to give it to another set of people and see what happens. Were your instructions good enough? Anyways, but it can be for anything simple. And for those of you who are still thinking like, oh, I can't look at that screen with all those steps on it, you would probably be a great contributor to the decisions, to the thoughts that go into it. And then you may not need to look back at this because you walk through it step by step. You're part of that discussion and analysis. And some of you may look at that and be like, oh my gosh, I love that diagram. I'm putting it on the wall. That type of thing. Okay, you can go to the next slide. Let me pause there for a second and see if anyone has questions about process mapping or what it is as a tool. I don't want to just rush through. Everyone feels confident making a peanut butter and jelly sandwich? All right. Well, feel free to jump in at any time. So one of the goals we had to do in the first few months of this collaborative is we had to come up with aim statements and goals, and how are we going to, in the Northwest region of our 2 counties, implement enhanced community support, enhanced care management and community supports. How can we successfully do that, especially in these rural areas? We don't have a lot of resources, we're all separated, but we came up with a plan, and one of the goals was really to establish a system of coordinated care across the providers. And one of the ideas to achieve our goal was to create a process map that aligns workflows and all that. We had lofty goals. We have a year to kind of get to a certain point with it. And so our question that we want to kind of put out to you, or for you to think about, is, are you already making process maps for these kind of things, or what would be helpful? And some examples of things we've heard from you that have actually come up at partnerships, ECM roundtables. They've come up in one-on-one conversations with all of you, or when we're doing TA, just in different ways. Here's a sampling of some of the things that we've heard from all of you that might be helpful. Like, I don't know where to start for the QIP, the quality incentive process, or I don't know how to get started to become a contractor, or just, I'm a CBO, a community organization. It all seems too big. Would it be better if I worked with other CBOs, care planning? Or I don't know if any of you were on the last ECM roundtable, but right now, if you want to expand to another county or to another population of focus, you have to fill an attestation form. But just making that decision to know if you're ready for more might take a lot. So those are some things that, as we're listening to you, are thinking, are they mapping out the process for that? Does it exist? Would it be helpful? So I think we're just bringing that up for all of you. And I think with that, I'll turn it back over to Rachel.
Thank you, Stephanie.
Sure.
So as a quick intro, there's a lot, obviously, that we could try to collate, but then also lots of active hands-on exploration and development of those various processes with you. So we want to not just continue to make assumptions based on past conversations, but rather follow up on them and do a nice check-in. So we have a poll with about half a dozen questions, and it's really to determine where you're at, what you're interested in, what you need, and how we can help you. So let's go ahead and launch that poll. If anybody has any clarification needs along the way, feel free to interject, and we'll clarify, because I'm sure if you have a question, everybody has a question. And again, you can answer at your own pace. So we've got a few sections for ECM services, process maps for enrolling clients, outreach tracking, complex clients, care planning, and then we have a couple questions for community support services, referrals and authorizing payments, and then your interests, what you would appreciate. And if the poll is not showing it for you, just let us know. Otherwise, I'll allow a couple minutes of silence because I know it's really hard to read when someone's talking at you. But the poll should be up for everybody. Thank you, Tammy. That's really helpful feedback. For number 8, looks like it is a single choice option. So a quick workaround we'll do now is pick your top choice. But if there are other process maps that you would like to develop, and you have multiple ways in which you would like to do that, go ahead and put that in the chat. So for number 8, which of the following would be helpful to develop process maps? Pick your top choice, and if others are favorable, enter them in the chat, and we will consider those as desirable options. Thank you so much, Tammy. That's really helpful feedback. We'll give it one more minute. I think that is most folks responding. Thank you so much. This is so helpful. We really want our planning to be in response for your interests and needs. Thank you, Meredith. That's helpful. Looks like we've got some process maps that have already been developed, some that are in the works with some interest to develop more. Really helpful to see the types of maps that are interesting for you. And it looks like everybody is interested at some level to engage in collaborative activities to do so, especially together. And again, any of those wanting the one-on-one technical assistance to explore that process, we're here for you. You can put your emails in the chat or email us at our path email. And I think we might be able in the poll results to see who would like that technical assistance. And if that's the case, we can reach out directly there too. Oh, perfect. Thank you so much. All right, so we will, okay, so we'll stop sharing. That's very, very helpful. Thank you, Max, for putting in our path email. Again, please use that liberally. I'm excited. This is fantastic fodder for potentially July's convening that we do together, and then again, ongoing assistance that we love to offer. All right. Next slide. But before we move on, are there thoughts about that? Like sometimes when I take surveys, right, it like elicits more thoughts of like, actually, I want these other process maps, or this reminds me of XYZ. Where are people's brains right now? What would be a helpful conversation? We've got about 5 minutes in our agenda to open it up.
Hey, everybody, can you hear me?
Yeah.
Hey, my name's Michelle. I'm the one that arrived late and it's my first meeting, so sorry. So I chatted in about sustainability options. And what I am learning is that most of the funding sources available to support CalAIM processes are either new funding or expansion funding. So I actually learned down at the street medicine conference that we hadn't applied directly to partnership for our ECM and community supports programs, but via the IPP funding. So unwrapping the tangle of these fundings has been a little bit of a challenge. And what I will say is that we all know with current reimbursement rates, even though we've served over 300 clients in our small rural community with no stoplight or Safeway in less than a year, we are pretty much being, it feels like we are being penalized in our funding applications, such as path cited, et cetera, and anything that I've been able to find that supports CalAIM, in that if you're doing too good and you're not going to add staff members or add programs or add people, the funding is not there for you. So it's been a real struggle. We have a case management team of 5. We are doing excellent work. For the first time in the history of our little county, one of our case managers has gotten between 40 and 50 people into permanent supportive housing in the north area of our county. We are talking dirt roads, an hour up the dirt road to pick someone up and get them back to their appointment of whatever sort. So, what can we do? If expansion isn't really a deal, but nobody will give us the money to continue our program? And is there any conversations about that? And what we can watch for down the path? Because I'm just trying to convince our executive director currently, as I charge thousands of dollars in post-hospitalization housing services and various other things, that eventually we will get some of the over $107,000 in claims that we've submitted paid, and that this program is not supposed to be going away and is almost like a pilot for the nation. And so, hey, what does that look like moving forward? We just have to have faith that we're going down the stairs in the dark and there is going to be a step there by the time our foot drops. Or do I have to lay off my 4 case managers in September? Okay, that's all. Thank you. So sorry. Thanks for listening.
Michelle, Rachel, do you want to answer first?
No, go ahead, Stephanie.
Oh, I just love that, Michelle. Thank you. That was amazing. And I just want to say, yes, we hear you. And this was a lot of our earlier meetings were just doing a lot of that. So you're at the right place. And it's like when I was making that flow chart for the decision around ECM contracting, I was looking at, did they specifically call out street medicine in folks experiencing homelessness example, and that they are the ones, those Medi-Cal members are the ones that, for predetermination, that you don't need to get approved. So I think what I would say is, yes, we can help you with that. And a lot of what we've been talking about recently is sitting down with certain organizations. There's a couple things, and helping you look at all of the different costs, administrative, operational, financial, like I was talking about. Not that you're not doing it well, but really putting together all these costs that are coming together. And then you have to look at what are the funding options that are available, and it's called kind of braiding and blending, and what are the sources you can pull from. So obviously you're doing really good work and it's not enough, and you're not going to lay off those case managers. We don't want you to. So what are all the levers that are available to pull on? And it takes too much time for someone in your position to figure them all out, because you're busy helping people who are unhoused and driving all over, a rural county. So I think the shorter answer is yes, we can help you because it's too hard to find. I understand what you're saying about the cited application. And sustainability wise, you know, enhanced care management and community supports are coming from what the Medicaid waiver, which is very sustainable. So figuring out how do you make this work for your organization and how do you access the correct funding streams is the challenge. And that's what we're here to help you with, and to figure out who the right folks are and to map it out, in a, you know, whether it's in a spreadsheet or looking at all the things and connecting you to other local providers. I know a couple chats have come in as well, but I would say you came to the right place, and that's why they have facilitator groups helping out in each region of the state, because it's not easy. And you're doing great work. We don't want you to stop.
Well, thank you for that feedback. And what happened is that the first week of June, one of my case managers and our physician and myself went to the street medicine conference down in LA, because we will be launching street medicine next month with current amount of deliverables that are already required. And so they really did this great little asset mapping of all the funding currently available that would support a CalAIM program in California. Unfortunately, we've done every single one of them already. So there's my concern. And so we are not expanding services, because as I've looked at things, again, they'll give you money for expanding, but not for continuing. And so I told our lead case manager, I know we are doing a great job and we technically are serving this population, but we will not expand to that population, because that will knock us out of future funding applications that require expanding. So we are actually either not providing services that we could that are needed, or we are providing them without contracting with CalAIM, just so that we can, quote, expand the next time money comes down the pike. So we've, again, applied for every application shared by any CalAIM conference that I've ever been a part of or meeting. And hey, we're still going to have to lay off case managers in September if we don't hear that we got path cited or find something else. So,
okay.
Yeah, Michelle, do you want to put your email in the chat, and we can reach out to you? And if anybody else wants to be a part of this topic of conversation, please add your email as well. We can get a group of us together. Thank you, Michelle, so much. And these, I think, are also really good examples of potential policy level issues that we can raise awareness to. And obviously those, take a longer time to, quote, solve. But if anybody has any workarounds or exploration, we can, add this and look at it together. So open invitation for everyone to join or to offer the workarounds and knowledge that you have already gone through. Yeah, Michelle, this is why we're here and why we're all together.
Can I just add something really quickly,
please,
Rachel? Because I know, Michelle, you joined a little bit late, so you may have missed sort of part of the first part of some of the things that we were going over. But one of the things that we've sort of been charged with doing in our role as facilitator is really listening to you and uplifting these issues, these really important issues you bring up to sort of the other folks that we're working with that can bring it to DHCS. And I know that for DHCS, really supporting ECM and community supports in rural communities is a huge priority. And so being able to learn about where those tension points and how it's not working is really important. So thank you for bringing that up and for, really helping us understand that experience that you're having.
Absolutely. I'm also super excited to hear about this group, because somehow, hey, we have ECM and CalAIM and community supports funding, but I didn't know about you. And so until we did this small partnership application to attend the street medicine conference and launch that program in August, that is how we got connected to y'all. So appreciate that. And we'll try to do better about being here on time in the future, because I find it, I think it'll be very valuable. So thanks again.
And where are you located, Michelle?
We are located in the southern end of Humboldt County. So our school district serves 764 square miles of rural mountainous terrain, and Eureka, which is our county seat, is 67 miles north of us. Okay. So a lot of CalAIM providers partner and kind of parcel things out. Redwood Rural, we are the only coordinated entry system point in Southern Humboldt. We provide partnership transportation. We have 5 case managers. We have the food pantry. So basically, we do all the things in-house besides specialists that somebody has to travel for, and then we drive them, right?
Yeah.
And we had HAP funding for the last 18 months. So we were providing a 10-room emergency shelter at a local motel for the last 18 months. That's how our 40 or more folks got housed. And that has officially closed now. We did not receive additional funding for that. So there is no emergency shelter currently now in Southern Humboldt.
It's really helpful to understand.
Yeah, I know we're not alone either. You know, obviously when I went to Los Angeles, we're a very different beast, and they were really excited to hear about that. And her name is going out of my head right now, but I know someone also approached me saying, hey, we're advocating for better reimbursement rates for street medicine, all Cal AIM services. And so I'm probably supposed to be hearing from her to give input and support. But we kept hearing we're far ahead of the game. It does not feel like that. We've submitted over $100,000, $107,000 in billing as of 2 weeks ago, and gotten maybe 40,000 reimbursed. So, hey, thank you, Dawn, our grant writer, for being here from the beginning. So the things I ignorantly missed and asked questions about can get relayed to me. And then other than that, we're again just trying to do the best we can, though I am fearful of expanding services and will not do so until I find out if expansion is a requirement of whatever funding we're going to seek next.
No, it makes sense. Any other quick thoughts from anyone? We've got a couple minutes for an update on our asset mapping, and then a couple minutes for next steps and upcoming events, and we'll end on time. All right, continue using the chat, unmute if you need anything. Sean, how's your connectivity? I want to pass over to Sean Aluko, who is one of our Merlin team members, our monitoring evaluation research team members who helped really put together our asset maps and then recently update them. Sean, are you here? Okay, he was having problems connecting. I will give a quick update. Next slide. So something else that we've been doing together the last few months is a lot of you responded to a survey with the assets in your region and how you are connected to them, which were put into a interactive map by our team. And so then you also provided amazing updates after we reviewed them together in person in April, and we gave an update of those maps and demonstration June 12th and 14th. So recordings of that demonstration are available online. And also, if you would like to add your organization to those maps, we are revising the survey that we used to update the asset map. And then that way it's a shorter survey that focuses on the information that is in the asset map itself. And so that will be able to be linked to our data dictionary that defines each of the pieces in the map. And once we are ready, we will share that with you and email that out through likely a MailChimp. So be on the look for that. We are also starting a short list of interested organizations that want their information added to that asset and connectivity map. And so if you are interested in adding your organization, then you can email us and we will put you on our short list to make sure that you get that abbreviated survey, but we will send it out to all of our registered participants as well. All right, next slide. Are there any questions about the asset map or updating? I'm going to jump to the next steps and upcoming events, but if you have anything at the end, we are here. So if everybody could please check your calendars. Our next regional meeting is in person. We are very excited about meeting with everybody again. Last time we did this was in April, so we are making it an intention to meet quarterly. And Jessica, do we have confirmation or a good idea of where we are with our location?
Yeah, we are in the contracting stage of getting to meet again at the same location. It is at the Sequoia Conference Center in Eureka. So once that's completely finalized, I'll make sure to get the address and everything to you all.
Perfect. And so that is Tuesday, July 25th from 11 to 2 in Eureka. So there should be a calendar hold that is already on your calendar. If you do not have that, email us. We will also be sending out updates for that. Also, DHCS really wants to hear from you guys directly about your involvement with these CPI collaboratives, how they're helpful, what else should be a part of them, etc. So there is a survey that they are asking everybody to complete by Friday. We had sent out a couple emails with information and logged in the link to a couple things. But if you haven't been able to do that yet, we also put the participant survey link there in the chat. And we, of course, have our website with resources. We will continue disseminating information about partnership or DHCS updates as they come as well. So I think that is all we have. Are there any other questions, ideas, suggestions, needs? How can we be here for you? We really, really appreciate this time together, and we wanted to make sure that we're closing the loop on the ideas and questions and concerns we've been hearing and checking in to offer a way forward. We will reach out to those who connected here today and continuing with each of you. Anything else? All right, it is 12:30. We'll stay on for another minute or two. I'll stop the recording. Thank you again so much for everybody coming today. We look forward to seeing you next month together and connecting with you in between. And we've got our emails here if anybody wants to reach out directly.
Thank you, everyone.